Lack of this mineral is causing your age spots. Age spots are marks that commonly appear on the skin after prolonged sun exposure. They are harmless, but some people wish to remove them for cosmetic reasons. Other names for age spots include solar lentigines and liver spots, though they have no connection to the liver. These marks are flat and darker than surrounding skin. They can be tan, brown, or black, and they may resemble freckles. In this video, we explore the causes and symptoms of age spots and describe safe ways to get rid of them. Symptoms of vitamin deficiency include brittle hair and nails, mouth ulcers, hair loss, scaly skin patches, and more. Recognizing these signs can help you adjust your diet accordingly. A well-balanced and nutritious diet has many benefits. On the other hand, a diet lacking in nutrients may cause various unpleasant symptoms or even serious adverse effects. These symptoms are your body's way of communicating potential vitamin and mineral deficiencies. Learn about common signs of vitamin and mineral deficiencies and how to address them. Brittle hair and nails. A variety of factors may cause brittle hair and nails. One of them is a lack of biotin. Biotin, also known as vitamin B7, helps the body convert food into energy. A deficiency in biotin is somewhat rare, but when it occurs, brittle, thinning, or splitting hair and nails are some of the most noticeable symptoms. Also, the prolonged use of antibiotics and some anti-seizure medications is a risk factor. Eating raw egg whites may cause biotin deficiency as well. That's because raw egg whites contain avidin, a protein that binds to biotin and can reduce its absorption. Foods rich in biotin include eggs, organ meats, fish, meat, dairy, nuts, seeds, spinach, broccoli, cauliflower, sweet potatoes, yeast, whole grains, and bananas. Bleeding gums. Sometimes a rough tooth brushing technique is at the root of bleeding gums, but a diet lacking in vitamin C can also be a contributing factor. Vitamin C plays an important role in wound healing and immunity, and it even acts as an antioxidant, helping prevent cell damage. Your body does not make vitamin C on its own, so the only way to maintain adequate levels of it is through diet. Vitamin C deficiencies are rare in individuals who consume enough fresh fruits and vegetables. That said, many people do not eat enough fruits and vegetables each day. Consuming very little vitamin C through your dietary selections for long periods can lead to deficiency symptoms, including bleeding gums and tooth loss. Another serious consequence of severe vitamin C deficiency is scurvy, which depresses the immune system, weakens muscles and bones, and makes you feel fatigued and lethargic. Other common signs of vitamin C deficiency include easy bruising, slow wound healing, dry skin, which may become scaly, and frequent nosebleeds. Vitamin C. It's important to eat at least 1.5 to 2 cups of fruit and 2 to 3 cups of vegetables each day. Poor night vision and white growths on the eyes. A low nutrient eating plan can sometimes cause vision problems. For instance, low intake of vitamin A is often linked to a condition known as night blindness, which reduces your ability to see in low light or darkness. That's because vitamin A is necessary to produce rhodopsin, a pigment found in the retina of each eye that helps you see at night. When left untreated, night blindness can progress to xerophthalmia, a condition that can damage your cornea and ultimately lead to blindness. Another early symptom of xerophthalmia is bitot spots, which are slightly elevated, foamy, white growths that occur on the conjunctiva or white part of the eyes. Hair loss. Hair loss is a very common symptom. In fact, up to 50% of male adults report hair loss by the time they reach 50 years old. A diet rich in the following nutrients may help prevent or slow hair loss. Iron. This mineral is involved in DNA synthesis, including that of the DNA present in hair. Follicles. Too little iron can cause hair to stop growing or fall out. Linoleic acid, La, and alpha-linolenic acid, ALA. These essential fatty acids are required for hair growth and maintenance. Niacin, vitamin B3. This vitamin is necessary for keeping hair healthy. Alopecia, a condition in which hair falls out in small patches, is one possible symptom of niacin deficiency. Biotin, vitamin B7. Biotin is another B vitamin that when deficient may be linked to hair loss. Meat, fish, eggs, legumes, dark leafy greens, nuts, seeds, and whole grains are good sources of iron. Niacin-rich foods include meat, fish, dairy, whole grains, legumes, nuts, seeds, and leafy greens. These foods are also rich in biotin, which is also found in egg and organ meat. Leafy vegetables, nuts, whole grains, and vegetable oils are rich in La, while walnuts, flax seeds, chia seeds, and soy nuts are rich in ALA. It's worth noting that taking vitamin and mineral supplements in the absence of a deficiency may worsen hair loss, rather than help it. For instance, excess selenium and vitamin A, two nutrients often added to hair growth supplements, have both been linked to hair loss. How age spots develop. Your skin contains melanin, which gives your skin its color. Melanin also gives you a tan when your skin is exposed to UV light. Age spots appear when melanin becomes clumped in the skin or is produced in high concentrations, such as when your skin is exposed to lots of UV light. Anyone can develop age spots, but you may be more likely to develop the condition if you have light-colored or fair skin or have a history of frequent or intense sun exposure or sunburn. Older women are more susceptible to age spots and sun damage because they have reduced amounts of melanin in the skin. What causes age spots? Age spots are a result of the body producing excess melanin. Melanin is the pigment that gives skin its color. When the skin is exposed to sunlight, the body produces extra melanin to protect the skin from the sun's ultraviolet, UV, rays. The more melanin produced, the darker the skin becomes. Age spots appear when excess melanin in the skin becomes clumped together. Symptoms. Age spots usually appear in areas of skin that are commonly exposed to the sun, including the face, backs of the hands, shoulders, back, arms, tops of the feet. Age spots can develop singly or in clusters. They vary in size and may range from 0.2 to 2.0 centimeters in diameter. Age spots tend to form in people aged 40 and over, though they can also develop in younger people who frequently get sunburns or use tanning beds. These spots can form on anyone's skin, though they are more common in people with lighter skin, which is more sensitive to the sun. Diagnosis. A doctor will be able to identify age spots with a visual examination. They may use a dermatoscope, which is a handheld magnifying tool that medical professionals use to examine areas of skin. In some cases, it can be difficult to differentiate an age spot from melanoma, a type of cancer that forms in cells that contain pigment. If a doctor is unsure, they may order a skin biopsy. This involves taking a small sample of the affected skin and sending it to a laboratory, where a technician will perform tests to determine the type of growth. Treatment. Age spots are harmless and do not require treatment. However, because they can resemble skin cancer, it is important that a doctor checks them out. If a person wants to remove a confirmed age spot for cosmetic reasons, they have a variety of options. topical creams can lighten age spots. However, avoid lighteners that contain mercury, as they may pose a serious health risk. A healthcare professional can prescribe a product that is safe. A prescription topical cream for lightening age spots may contain retinoids, such as tretinoin, cortisone, hydroquinone. These creams lighten spots gradually over time. They can sometimes irritate the skin, so it is best to discuss side effects with a doctor before deciding upon the right cream. Home remedies. Natural remedies may also help lighten age spots. These include aloe vera. Some research in animals suggests that applying aloe vera to age spots each day can lighten the marks. Red onion. Results of one study indicate that dried red onion skin may lighten age spots. A person can look for topical creams that contain allium cepa. Orchid extract. Authors of another study concluded that orchid extracts may lighten age spots. The extracts are ingredients in some skin care products. Topical creams can also reduce the appearance of age spots. Research suggests that creams containing one or more of the following ingredients may help: azelaic acid, vitamin E, vitamin C, alpha-hydroxy acid. Some people use makeup to cover age spots. A dermatologist or cosmetics salesperson can offer advice on useful products. Prevention. It is often possible to prevent age spots from forming. The AAD recommend using a sunscreen with a minimum protection of SPF 30. It should be water-resistant and have UVA and UVB protection. Apply the sunscreen to exposed skin 15 minutes before going outdoors. Using an SPF 30 cream every day can also prevent age spots from getting darker in the spring and summer.